Hello, I'm Dr. Ira Shah, and today we are going to talk about common dilemmas that we see in pediatrics. First, let's start with common infections that we see, that's respiratory tract infection, and of that the commonest is an URTI. Now URTI, most of the patients will come to you with diagnosis or symptoms of fever, cough, cold. We don't even realize what we are dealing with, and we just give symptomatic treatment in the form of paracetamol, some cough syrup, some cold medicine, antihistaminics, and sometimes even antibiotics. But we need to really identify how we are going to treat each condition. Now remember, a URTI consists of something which is above the larynx. So it's going to be your sinusitis, rhinitis, nasopharyngitis, otitis media, and tonsillopharyngitis. Not all of these conditions require antibiotics. A child with nasopharyngitis is just going to come to you as cold and fever. A child with sinusitis is going to come with cold, fever, and a postnasal drip which causes early morning cough. They tend to have sinus tenderness. A child with otitis media is going to come to you as fever, pain in the ears, probably cold, and sometimes there may be ear discharge. A child with tonsillopharyngitis is going to come with fever and cough. He's not going to come to you as cold. Now, how do you treat these conditions? When do you use an antibiotic? Nasopharyngitis, no antibiotic. Otitis media, probably an antibiotic, but we'll come to that later. Tonsillopharyngitis, when will you need to give an antibiotics? When the infection is by group A streptococcus. Otherwise, you don't need to use an antibiotic. Sinusitis, you need to give an antibiotic in certain conditions. Remember, sinusitis and tonsillopharyngitis, commonest cause is still viral. Sinusitis, if you have severe sinusitis that is lasting for more than a week, then you may consider antibiotic. Tonsillopharyngitis, if it's in the age group between 3 to 14 years, that's the time when you tend to get rheumatic fever. When there's high grade fever more than 39 degrees, there are tender cervical lymph nodes, there's no cough, then you consider that this child may be having a bacterial tonsillopharyngitis. Ideally, you should confirm it by a streptococcal test, throat swab. If you can't, then you can take this MAC-ISAX classification in which you have fever more than 39 degree, you have the age group between 3 to 14 years, tender cervical lymphadenopathy, and you have exudates on the tonsils. If you have these conditions, you know that this is bacterial and give an antibiotic. Otherwise, you just need to give symptomatic treatment in the form of paracetamol, probably an antihistaminic in children more than 2 to 6 years of age, and a cough syrup. Thank you.